All right, so the next thing we're going to do is partial bed bath. This is the longest skill we have. It's super long. And we're going to get to the care plan in just a minute, but I want to talk to you about the leaves method. And we actually saw this with PeriCare on Monday, if you remember PeriCare. But this is just a plain washcloth. So a plain square washcloth, folded in half and folded in half again. So it's a square, you know, folded in fours. Everybody has one of these in their, you know, linen closet somewhere. But if you take this washcloth, instead of looking at it like a square, which is what most of us look at it as, I want you to turn it to a diamond shape. So one of the points is up, you have one on each side and one is down. So this is a diamond shape now. And you want to position it in your hand so the free ends are at the top. So this is like the opening is at the top. If you tuck in the two sides like this, now you have an area to clean. And when you clean that area, you're going to fold this over and that traps the contamination underneath. And now you have a new clean area to use. You can fold that over, which traps the contamination underneath. And now you have a new clean area to use. Fold that over, traps the contamination underneath. Now you have a new clean area to use. And if you had to, you could even fold that over and use the back side as another new cleaning area. So this is called the leaves method. And we use the leaves method if we're going to wash any wet body opening. A wet body opening is something like eyes, nose, mouth, genitals, which is why we use it for PeriCare, anal area, wounds, sores, rashes, or incisions, anywhere where stuff can come out of the patient. And if you remember when we talked about pathogens, and we said that pathogens had to have a way out of where they're living and have to have a way into the next host. Well, when you're washing a patient and you're around wet body openings, that is both a way out, but also a way in. So we want to prevent pathogens from one area moving to another area by using the same washcloth. So if we're going to wash any wet body openings like the eyes, we're going to use that leaves method, wipe one eye, fold that leaf over, and then wipe the other eye. We'll fold that leaf over and then wash the face. And I'll probably fold that leaf over and do the nose last, just because we don't like boogers everywhere. So you use the leaves method if we're going to wash any wet body openings. Now, if we're washing intact skin, so like this skin, there's no sores, no wounds, no rashes, no openings. It's just skin. I don't need the leaves method. I just need one part of the washcloth, just the top, and I can wash all of this skin all over here because there's no wet body openings there for stuff to leak out or stuff to go in. So we only use the leaves method if the skin is not intact. So your eyes, that's a skin opening. It's not flat skin, there's an opening there. Nose, there's a skin opening. Mouth, skin opening. So keep that in mind. The leaves method is going to be used anytime we're washing a wet body opening. So if you're doing a partial bed bath on a patient and they've got shingles, which is a wet, weepy rash on their arm, just a strip on their arm here, you would use the leaves method when you're washing around that section to be able to trap the contamination so you're not spreading it to other areas on the body. Does that make sense?
Yeah.
Yes. Any questions on that?
No.
Those of you with children will use this leaves method that I just taught you 1,000,000 times on your kids. You will find all kinds of uses for this because it really is very, very helpful. It increases the surface area of the washcloth. It allows you to wash more areas without that contamination. So it's very, very helpful, you know, in a lot of different situations. All right, so that is the leaves method. Let's go ahead and pull up the care plan for this particular skill. Okay, so this skill, the care plan, is very, very, very specific. The care plan tells us to give the resident a partial bed bath and back rub. This is not a full bed bath. We're not going to wash from head to toe. It's going to tell us exactly what it wants washed. So it says to wash the resident's face, neck, chest, abdomen, back, one arm and hand with soap and water. So it's very specific. The best way to remember this is face to waist, front and back, one arm. So face, neck, chest, abdomen, back, one arm and hand. Tells us to wash with soap and water. It also tells us to give the resident a back rub. Now, we are not massage therapists. We're not deep tissuing anything. The only reason we're giving a back rub is to wake up the capillaries, to encourage circulation, and overall just help the patient feel better. Just a really light back rub just makes the patient feel a little bit better, especially, you know, if they're feeling down or sick. So it also tells us to use lotion to provide that back rub. So we'll maintain those lotion rules. Remember, we always warm it up and then wipe off the excess. It says to dress the resident in a hospital gown. Patient is lying on back and center of bed and can roll as directed, but is too weak to assist with bathing. So if you scroll down, you can see this has a whole lot of supplies. You have to learn all of the supplies, and it has a ton of steps to it. This actually goes off to the next page as well. If you look at the bottom, you'll see that the test info, it tells us that this should be done in 19 minutes. But most importantly, it is going to be done on a mannequin. So this is a mannequin skill. So for the test, we're going to do this on a mannequin. Now, you guys don't have a mannequin at home. You probably don't have a way to practice this. And this is kind of hard to do on a real live human person because, you know, they're going to be undressed. So unless it's somebody that you're really comfortable and really familiar with, this is kind of hard to practice in a home setting. But you can, if you have a baby doll lying around, give a partial bed bath just on something a little bit smaller. The steps are the same. Whether you're washing a large human or a small baby doll, the steps are the same. So you can substitute a baby doll or a teddy bear or something like that to go through the steps to be able to practice this before you get to the state exam. But this is done on a mannequin. Now, just like every other mannequin skill for the test, when you talk to the mannequin, the evaluator is going to talk back. So you will get an answer, and it'll come from the evaluator. So don't not talk because it's a doll. You really want to make sure you're showing that interaction. All right, so there's not much to show you with this one or to talk about. It's pretty cut and dry. You're going to wash, rinse, and dry the face, neck, chest, abdomen, one arm and hand, and back. It's that simple. Whatever you wash, you rinse. Whatever you rinse, you dry. Don't get the bed wet, so we'll put a towel on the bed so that we're not getting the sheets wet. You're going to wash the face first. No soap on the face. Soap dries the skin. It can sting the eyes, so no soap on the face, just water. Remember that when you're getting water for a patient, we're going to turn the faucet on with a paper towel, check the water with the inside of our wrist. It should feel warm, not hot, not cold, just warm. You're going to fill the basin and then let the patient check the temperature and make sure it's appropriate. And then we're going to follow the same washing rules that we've always used. So I'm going to show you this video. Again, this is kind of a long video. I think for the video I take, I don't know, 13 or 14 minutes to get it done. You've got 19 for the state exam. It's plenty of time to do this particular skill set.